This European Public Health Week, we are reminded of the importance of coming together as an international community to protect and improve the health of populations globally. As public health professionals, we know that we must tackle the unacceptable health inequalities that we see in the populations we serve. We know too that the devastating impacts of COVID-19 have not been felt equally across society, and that the pandemic has only served to exacerbate these pre-existing inequalities. That is why, as President of the UK Faculty of Public Health, I am pleased to support today's European Public Health Week with the theme of leaving no one behind. Indeed, I see this message reflected in our own faculty mission as better health for all. When I took up my presidency of the Faculty of Public Health in June 2019, we were not to know of the events that would unfold over the next 2 years. What we did know, though, was that health inequalities in the UK were already widening, and for that most disadvantaged groups in society, life expectancy was stalling and in some places was even falling. Our faculty strategy in 2020 to 2025 then focused on supporting our members, the UK's public health workforce, in delivering their exceptional work to reduce these very stark inequalities. What we saw in the coming years made this work all the more important. Deaths from COVID-19 directly correlate to the social gradient, and those in the most deprived communities have faced job losses, evictions, mental and physical illnesses at a much higher rate than those in the least deprived areas. This compacting of inequality will continue for years to come unless governments work with us as public health professionals to ensure that the better health is delivered for all, with leaving no one behind. This message rings true most immediately for vaccinations. While the UK has been a global leader in COVID-19 vaccinations, as public health professionals, we know that this pandemic cannot be tackled in isolation. Just as we have supported those facing barriers to accessing vaccines in our domestic population, the Faculty of Public Health has called upon the UK government to do more to support global access to COVID-19 vaccines. The message of leaving no one behind does not recognise international borders, and public health professionals across the globe recognise that the only way to overcome this virus is to work together to protect health for all. As such, the faculty has joined with the UK Academy of Medical Royal Colleges to call on the UK government to release pre-purchase vaccine orders to countries least able to secure supply. We also called on government to support the scaling up of local manufacturing capacity in low and middle income countries, and to support health systems strengthening to ensure the countries can effectively distribute vaccine doses as well as procure them. The importance of this global mission will be recognised by the international public health community. We must continue to work together to protect and improve the health of our citizens. It is not something that we can achieve in isolation. I thank my colleagues in Europe and across the globe for coming together this European Public Health Week to highlight the importance of continued international collaboration. I look forward to continuing to work with you to deliver better health for all and to make sure that we leave no one behind. Thank you.